Hi, I'm Ashley. Nice to meet you.
Nice
I'm
to
a
meet you.
student here at Dr. Furso's office. What are you coming in for?
Well, I just have this horrible, knee discomfort pain. It's just really swollen, and I think I hurt it pretty bad.
What were you doing?
Well, I was working out at my gym and kind of doing those agility sprints back and forth,
Mhm.
and I, planted, and I just, it twisted or did something, I don't even know, and then I just kind of, fell, and it kind of hurt, and I kind of could walk on it initially and stuff, but, this morning, it is, really swollen, and I can't hardly put, any weight on it.
Well, that sounds terrible. Have you ever injured your knees before?
No, they've hurt sometimes after, working out, but that's pretty typical,
Okay.
A lot of
Excuse me. Excuse me. So you fell to the ground. Could you walk initially after that?
Yeah, I could put a little weight on it, and it wasn't horrible and stuff. But this morning, I can't
It's
hardly.
been hard. Okay. So it just happened yesterday,
Yeah, it's been about a day and a half.
and you haven't had no problems at all before this.
Mm-mm.
Okay. What does it feel like? Is it painful? Is it achy? Is it sharp?
It's just kind of painful and swollen, and it just doesn't feel right.
Okay. And then you said you can't bear weight as much today. Initially you could. Did you do anything to try to help alleviate the pain?
Yeah, I did. I kind of elevated it and put some ice on it last night. Took some ibuprofen, and that helped. That did help a little bit. But this morning, it was just really stiff, and it just hurt really bad after laying in bed.
Other than laying in bed for too long or trying to walk on it, is there anything else that aggravates it or makes it worse?
Yeah, I really been babying it, so I haven't done a lot with it. But yeah, those are kind of the big things.
Do you have any pain radiating out anywhere else?
No, not really.
Okay. And then what would you rate your pain?
Right now, it hurts. It's an 8, maybe.
Okay.
But when I'm really trying to do anything on it, probably 10.
That's not any good. All right. Well, I'm just going to ask you a few other questions. Do you have any other pertinent medical history?
No, not really. I'm pretty healthy.
That's good. How old are you?
I'm 19.
Excuse me. Do you live at home or on your own?
I am in college.
You're in college. Yeah, that's good. That's good. Do you have a boyfriend or anything like that?
Don't have time for them.
No. Are you included in any recreational sports, or do you just work out?
I just work out.
Okay. Did you do any sports in high school?
Yeah, I did track in high school.
You never had any knee problems?
No,
or joint
it was
problems?
more shin splints, ankle issues than it was knee.
Okay. And have you had any surgeries or any other medical history?
I did have my wisdom teeth taken out. But that's about it.
All right. And do you have any allergies?
To penicillin.
Okay. And then your family, do you have any brothers or sisters with joint issues or any other family medical history that might be relevant to today?
My mom had her shoulder done at one point, and then my grandmas probably both have arthritis.
Okay. Anything on your dad's side?
No, he's just has some hypertension.
Okay. All right. Well, I'm gonna wash my hands here, and then I'm gonna listen to your heart, kind of make sure everything's okay there. Speaking of which, you haven't had any recent infections or illnesses or sicknesses?
No.
Not feeling a fever
Mm-mm.
or chills or body aches anywhere
Mm-mm.
else? No nausea, vomiting?
Mm-mm.
Okay. That's good. Have you gotten all vaccinated since you're playing in college?
Yeah, I got all that stuff
Your
done.
meningitis?
Yes.
Okay. Well, let's just kind of do some tests. I'm going to listen to you. I'm going to take your vitals, and then I'm going to do some maneuvers with your knee. I'm going to try it, of course, first on your normal knee that's not injured, just to kind of give me something to compare off of to see, if there's some subluxation or just some mass relaxation and no tightness or something like that. That would
Okay.
point me towards any problems. I'm just going to listen to your heart first. Excuse me. normal sinus rhythm, heart rate 73, S1 and S2, heard no clicks, scallops, or murmurs or rubs, so you're all good there. If you could take a deep breath for me. Again. No adventitious lung sounds heard. I'm just going to listen to your backside really quick here. Again, nothing hurts, so you're good there. Do you have any other joint issues besides just the knee? Do you have like any problems? Are you sore anywhere else? Any neck? Since you said you fell to the ground, you can move your neck. Everything's good there. Up,
fine.
down. Okay. You have full range of motions in your arms. You're all good there.
Mm-hmm.
Nothing's hurting. I'll just come over here. No crepitus or anything. That's good. Excuse me. You have a little bit of a dry throat, so your right knee's the hurt one. If you want to lift up your legs, and we'll kind of go on to the side here. I'll give you a little help.
Thanks.
Are you safe?
I hope so.
Okay, I'm gonna first
Make sure you're not
just
seeing
try to palpate some stuff here. Well, that didn't work. Because this one, it happened in a real thing. But I'm going to just pull and push on your patella. Just let me know if there's any pain here at all.
No.
No?
No.
Little tenderness?
Yeah, I mean, but not bad.
Okay. You have a little pinkishness tinted to your right knee opposed to your left, which is normal, warm, dry skin. Excuse me. And then, it's about 3 edema in your knee here. It's pretty swollen.
Mm-hmm.
And does it hurt when I touch it? A little bit?
Just a little, yeah.
Okay. All right, I'm going to do some range of motion exercises. I should probably go to the other side of the table to get to your good knee. Let me know if anything hurts, your wrist, your ankle or your hip. But I'm going to first, this up, just be passive here.
Okay.
Does this hurt at all?
No.
Okay, I'm going to do, it's called an anterior posterior drawer test. So just leave your knee passive. Does that hurt at all?
Mm-mm.
Okay, good. And then if you could just rest it out here. I'm going to turn this. Does this hurt at all?
Mm-mm.
What about now?
Mm-mm.
Okay. And is your hip hurting at all?
No.
Can you lift your leg off the... Okay, sweet. Thank you. I'm going to go to the other side here. I'm going to try to not over here. Same thing. I'm just going to pull this up here and see if this hurts or not here. So just relax, okay?
Okay.
Does any of that hurt at
Yeah,
all?
there's definitely some discomfort with
How-
that. It just feels weird.
Okay. Excuse me. And then I'm going to try do this one rest here. Does this hurt? A little bit.
Little bit, yeah.
Okay.
Yeah.
And when you extend your leg out, can you lift it up off of without it hurting? Does that hurt quite a bit?
Yeah.
Okay.
It's just when I put pressure mostly too.
Okay, does your excuse me, is your hip hurting at all during any of this?
No.
And then I'm gonna do the last thing. I'm gonna kind of push into it. If it's your ACL, which is what it seems like it might be, it's going to hurt just a little bit, but just
Okay.
let me know if the pain gets too much at any time, okay?
Okay.
You just kind of rest here. And I'm going to grab, kind of push this in.
Ooh, yeah.
Sorry.
Yeah, that
Sorry.
hurts.
Here, do you want to lean up?
Thanks.
And then we can get your leg. While you're resting here, can you point both your toes and flex up? Does that hurt at all?
No, not really. I mean, I could do it. Maybe less on the right, but I think that's just because of the swelling.
We had a positive Lachman test, which is the one when I pushed in your knee joint there. That's usually a pretty telltale sign of an ACL tear. And especially since you're still having pain, it's probably a partial tear, so you could probably get some rehab and probably get an ortho consult. You also had an anterior drawer test was positive, meaning when I pulled out, there was subluxation or some extra stretching that shouldn't be there that's normally in a tight knee, like your left knee was fine. The posterior one pushing in, so I know it's not your PCL. There's the two ligaments that cross in the back of your knee. Your MCL I tested, and your LCL, which are the medial and lateral sides when I turned, those weren't really hurting, so you didn't do any extra damage. It sounds like your ACL just kind of gave out, and you don't seem to have any swelling or patellar problems. So it sounds like you've got a good old ACL tear, and a lot of young female athletes tend to have that. So we'll get that looked at. If it's not an ACL tear, I mean, it could possibly be a PCL tear since you're still pretty swollen. We can't do a really thorough testing, so we might have you continue to ice and ibuprofen and maybe come back in 5 days and see how that is and start you on some physical therapy if it's a PCL tear. Otherwise, it could just be some generalized inflammation and a sprain, but we'll get that going. But should probably, I don't know if I checked your vitals, make sure you're not having any problems with your hypertension or anything. Normal there. Let me check your pulses. That's good. Check your pulses here. 2+ on your pulses, 112/60, so you're good there. And your oxygen saturation in room air is 99%. So I'm not worried about you otherwise. Do you have crutches or anything that you need?
I'll probably need some.
Okay, so we'll get that out on front. Does you have any other questions for me?
I don't think so.
Okay, well, it was nice to meet you. I'm sorry you're hurt.
No,
Come back and see us later.
Thanks.